Good morning, Representative Fauci. My name is Brianna Forbes, and I have worked as a women's health nurse at UNC Medical Center in North Carolina's 4th District for the past 6 years. I am here today to lobby for the passing of House Bill 2319, Women and Lung Cancer Research and Preventive Services Act of 2025, a bill that could save lives in our community. H.R. 2319 was first introduced on March 25, 2025, and received a recommendation for congressional consideration on April 29th. Passing of this bill would establish an interdisciplinary analysis on the current state of lung cancer research in women and other underserved populations. It would also assess access to lung cancer preventative services and methods to best educate the public on lung cancer screening. Passing of H.R. 2319 would help us develop tangible solutions to save lives in communities like ours. This bill critically addresses populations that have been long underscreened, understudied, and underserved. According to Flores et al. In 2024, lung cancer is the leading cause of cancer-related death among women in the United States. Furthermore, Tubat and David in 2023 note that currently only 12% of eligible Americans receive appropriate lung cancer screening. Warner et al. In 2024 found that women and underserved populations face even greater barriers to accessing screening, as many receive less targeted education about this preventative, and many develop lung cancer earlier than their male counterparts. As a women's health nurse, I have had firsthand experience with the devastating impact of late-stage lung cancer diagnoses. I've cried with women who have told me they had no idea they were at risk. And like many of us, they figured that only older people who had a history of smoking got lung cancer. And no one on their medical team was pushing for screening either. These patients have shown me that education and access could have prevented their pain and suffering, and sometimes death. According to Flores et al. In 2024, there are currently no differences in treatment and screening options between men and women. Considering that women have different risk factors, many of which are still understudied, this further drives my passion behind supporting this bill. More research and subsequent education are needed to help address this gap. I recognize that some opponents of H.R. 2319 may feel concerned over the additional cost of said research and education. However, I believe that the savings from early detection and prevention will outweigh this. Representative Fauci, if you choose to support H.R. 2319, Women and Lung Cancer Research and the Preventive Services Act of 2025, you would be bolstering much-needed research, improving access to life-saving screening, and helping women and underserved populations, not just in North Carolina's 4th District, but across the nation, access care that they deserve. Thank you for your time and your consideration.